We've always done it this way. When it comes to your healthcare, that excuse keeps patients waiting, doctors frustrated, and costs skyrocketing. It's one of my biggest frustrations when it comes to our efforts to lower surgical wait times in Alberta. Yes, Alberta is moving forward. We're performing well over 10,000 more surgeries each year than we did in 2018-19, and that's good. But let's be honest, I know that's not good enough, and you know that's not good enough. No matter how much money we pour into the system, the improvements are too small, too slow, and too inconsistent, especially when it comes to surgery. The system isn't working, and I don't care that we've always done it this way. We need to make bold changes. We need to look at what top jurisdictions are doing around the world and implement reforms to improve your care. Albertans deserve surgical wait times that don't just marginally improve, but meet the medically recommended wait times for every single patient, because our population is growing rapidly, and the needs of patients keeps growing with that. So the same old isn't going to cut it. Our front lines are doing everything they can, but the system is holding them back from making decisions that improve care. Our outdated system is driving away the very professionals we rely on. That's why today, I'm announcing that Alberta Health will modify our funding formula for scheduled surgery from global budgets to activity-based or patient-focused funding. That means funding will soon follow patients to drive more high-quality surgery for Albertans at lower costs. That's because we'll foster competition, so all medical centers, whether charter surgical facilities or hospitals, get rewarded for delivering results for patients. We will increase transparency, lower wait times, and attract more surgeons, just like we've seen in Europe and Australia who use this model. Allow me to explain. Right now, under global budgeting, our system works like this. The government generates revenue from taxpayers. Always important to remember, this money is yours, not the government's. Then via the provincial budget, Alberta Health receives billions of dollars and gives that money to Alberta Health Services to manage it. AHS then distributes a pot of money to all the various hospitals and publicly funded facilities based on expected outcomes. The problem here is hospitals miss their targets, and there's no accountability because they've already got the pot of money. In fact, hospitals will often stall on surgical procedures so they can use their global funding in another way. So even if a hospital promised to perform 300 surgeries, they may only deliver 100 with no accountability for administration. That is wrong. Global budgeting also limits our ability to leverage charter surgical facilities who can do routine procedures much faster and can often adopt new techniques faster than hospitals. There's no magic with these independent surgical facilities. They are groups of doctors who put up capital to build a facility and then perform simple, high-demand, scheduled surgeries paid for by public funds. Since they are smaller collaborative local teams who do the same surgeries every day, they get incredibly good at simple hip, knee, eye, and other procedures, often performing 2 to 3 times more surgeries in the same block of surgical time as at a public hospital. We need to use them more to ensure cost certainty, but also because handling routine surgeries independently frees up capacity in our hospitals for more complex surgeries. The charter surgical facilities also help attract more surgeons to Alberta because they create more operating room space. Surgeons can perform more surgeries and then get paid more. These doctors often also work in our hospitals, so it's a win-win across the system. But the old top-down approach offers no incentive to do more for patients and limits our ability to direct dollars where they can get the best results. While the global budgeting model will still be used for small rural facilities and general admission and emergencies, it is not working for surgery in most of our busy hospitals where efficiency is a must. Here's the reality with global budgeting. There's no incentives to increase volume, no accountability, no cost predictability for taxpayers. The result? Long wait lists for scheduled procedures like we've seen across Canada. That's why we're switching to activity-based funding or patient-focused funding for surgery. First introduced in 1980 by Yale University's Dr. Robert Fetter, this model has been widely adopted in the US, Europe, and Australia. It's a simple 3-step process. 1. Turn common surgeries like knee, hip, back, eye, and other procedures into a product with clear fixed pricing. The pricing will change slightly depending on complexity and aftercare needs. 2. Facilities compete to deliver surgeries for patients. 3. Each facility is paid based on the number of surgeries performed. That's it. It's pay for results rather than black boxes of money with no incentive to improve. Australia is the gold standard for activity-based funding and has a similar system to us in Canada. They introduced activity-based funding in 1993 for surgery, and Australians saw a 57.3% decrease in wait times for urgent and semi-urgent surgery within 1 year. Other countries have seen outstanding results as well. That's because it's a bottom-up approach, rather than top-down, that incentivizes volume because funding is only delivered when the service is provided. Facility administration has to be accountable to deliver results and is motivated to use resources efficiently, or their funding dries up. If hospitals have idle operating room time, they will have to be creative, or they won't get funding. For example, if the hospital becomes more efficient with their scheduling and staffing to perform more services, great, they receive more funding. If they can't do it, administrators could rent idle operating room space to a group of doctors to increase funding. Or maybe charter surgical facilities can deliver more surgery. Then they get more funding. Either way, money follows patients, and every provider is motivated to increase volume by fostering competition. It's also more cost predictive for taxpayers with accountability for hospital managers and all providers. Of course, every surgery must meet the highest standards, and that's exactly what Acute Care Alberta will do through dedicated oversight. In fact, our experience, especially with charter surgical facilities, shows that care is very high quality. These teams perform routine surgeries daily, allowing them to perfect their craft and quickly adopt the latest research and techniques for faster, better outcomes. To review, with activity-based funding, there is built-in incentives to increase volume with high quality, cost predictability for taxpayers, accountability for all providers. Where this has been tried, the result is lower surgical wait times and higher quality care. Don't get me wrong, this change will be difficult, as is any change in a large system. But I will not sit around and not make change because of ideology or the way we've always done it. You deserve better. You deserve your surgery within medically approved times. Alberta will lead the way and get it done. Thanks for watching, and please share this video.